shit, $8,000 for 15 minutes? 250,000 families every year go bankrupt due to a medical expense, even though they have health insurance. This system is so extremely busted. It's a huge market. I mean, maybe the biggest market on the planet, 5.6 trillion. If we can get Bitcoin circularity within healthcare, that sets the stage for Bitcoin circularity in other places. Once you lose all that subsidization, you go into a death spiral. If I can take down the financial system and the healthcare system, two birds, one stone.
That's Andy Schoonover, CEO of CrowdHealth, on a mission to drive Bitcoin adoption and re-engineer the fiat healthcare system before it collapses and costs you everything. In this episode, we'll discuss Andy's entrepreneurial journey that ultimately led to his clash with the insurance companies.
Somebody has got to get this figured out. And so I was like, let's make an option.
The pervasive incentives corrupting the healthcare system, inevitably leading to its downfall.
It doesn't take safety and with a PhD in economics to understand if the buyer and the seller want the price to go up, the price is going up.
How Bitcoin is revolutionizing more than just financial markets.
That's the problem with insurance. They got this big pool of fiat. And he's like, man, what can you do with Bitcoin here?
Plus, Andy reveals his surprising connection to a billionaire tech mogul. Good morning, Andy. Thank you so much for joining me today. I wanted to start off the conversation by getting a little bit of your history. And we were talking a little bit before hitting the record button there that in my mind, I had your healthcare journey starting with your daughter's, I believe it was an ear treatment that she needed. But you were saying that this goes back even further, your journey into healthcare and kind of having a realization of what's really going on here. So please kick it off. Tell me, how did you get started on this trajectory? What was the genesis of everything that started happening for you?
Yeah, I mean, it's really just kind of an entrepreneurial journey, right? And we can talk about, the chaos that I had with healthcare, but my first start of this journey was back. I was at business school out at Stanford, and there's we talked about this, but you've seen The Social Network. I'm sure a lot of people here have seen The Social Network. Well, there's this subplot within The Social Network where Mark Zuckerberg is taking his buddies from East Coast to Silicon Valley. And Eduardo, who was his co-founder, had to go to his dad to get, I think it was $16,000 to pay for this house that they were going to live in. And, funny enough, Mark Zuckerberg walks into my house with a $16,000 check and hands it to us. And so that was actually like our house in the movie, which is super, super funny. It's small world. But, I say that is because I graduated from business school in that period of time where Google was taking off and Facebook was taking off, and all of my buddies went and did the big Silicon Valley high tech stuff. And I kind of always had this mentality of doing something a little bit different. And so I was like, I'm going to go buy a company and see if I can run this thing. And so I bought a little company in, of all places, Dayton, Ohio. And so raised some money to buy that. And it was it was like that fall and I can't get up button. You probably have seen the commercials.
Yes, I have.
It looks like it's from like 1984 or something, because I think it was, it's just an old lady on the ground. I was like, I fall and I can't get up. And so we bought a company. It was actually a competitor to that company, but bought that company and realized when we got in there that all of our customers were like 83. They had 2 or 3 diseases. And so, once they're on the floor, it's a reactive thing. Like you lose your customer, they're going to the hospital, they've broken a hip, they've done something where you've lost that customer. I said, man, what if we actually took a preventative approach to this? And actually we put a little Bluetooth module in there so they can monitor their blood pressure and their blood sugars and things like that. And so we started, funny enough, selling that to health insurance plans to keep people from going into the hospital. Sold that to a private equity group after 10 years of running it. And at that point, I was like, man, I'm not doing healthcare ever again, because it is bureaucratic. It's administrative. They don't make any economic decisions. And so it was my first kind of recognition that this healthcare system is totally busted. Well, then I came off of that company, and most of us get health insurance through our employer, at least here in the United States. And so I didn't have health insurance anymore. And so I went to the Affordable Care Act, or Obamacare, as we call it. And I got a plan for me, my wife, and my 2 girls. And it was like $1,200 a month. And I was like, all right, well, I guess this was my only option. And I joke it worked until I had to use it. My little one, who was 1 at the time, was having a recurring ear infection. So we went to the ear, nose, and throat doctor, who's like, she has a hole in her eardrum. And so no big deal. We'll get it fixed. It's a 15-minute procedure. We went and did that. We did everything right. We got the bill, I think 3 or 4 weeks later. So it was $8,000 for 15 minutes. I was like, holy shit, $8,000 for 15 minutes. But this is what health insurance is for. Like, this is the whole point of health insurance. And little did I know I was going to get another note a few weeks after that from my health insurance plan who said it was medically unnecessary. And so they weren't going to pay the bill. Then I was like, hold on, medically unnecessary? My daughter has a hole in her eardrum. Like, how is that medically unnecessary? So we went through a couple of appeals processes, and the insurance plan was like, nope, we're not paying for it. And it's like, so I had to stroke an $8,000 check to get this procedure paid for. And it was at that point where I was like, this system is so extremely busted. Somebody has got to get this figured out. I think it's a lot. I was probably in the same place where a lot of Bitcoiners are over the last 10 years, right? Like, this system is so busted. How can I do something different? And I'm a Bitcoiner as well. And so it's like, oh, we're going to put our money into Bitcoin as opposed to this fiat. Well, I didn't have any options on the healthcare side. And so I was like, let's make an option. Let's create something, you know, maybe it's like the Satoshi moment where he came to this revelation that the fiat money system isn't working. And so we started CrowdHealth in 2021, and we've over the last 4.5 years have helped almost 25,000 people pay for their medical bills while being uninsured, basically breaking away from the medical industrial complex and saying, no, I'm taking control over my own healthcare, and I'm not going to be subservient to these big health insurance plans to have them pay for it. I think there's a better way. So that's the quick creation story of CrowdHealth, but I think it's very analogous to what we as Bitcoiners are seeing in the Bitcoin world. You come to a conclusion: our system is busted. How can I fix it? Praise God for Satoshi. However many years it was ago now, what, 2009, right?
Yep.
And so I mean, we just had the birthday of the white paper, right? Like last week. So we kind of got to that point of like, we've got to create something new that is less reliant upon centralized decision makers and to decentralize it. So that's in essence what we've done with CrowdHealth, is decentralized healthcare, and it's worked beautifully over the last 4.5 years.
That's fantastic. And immediately too, like, I love that entrepreneurial spirit. I also love that you, how do I phrase this? It's like a very authentic entrepreneurial spirit. We're like, I'm not going to do the sexy thing. I'm going to go find that's a good business that I know that I can improve and maybe then sell this later on down the road. Like it's not in the movies. It's not the startup. It's like, let me go find a good company. It's like, I think it was Parks and Rec. It was like, I'm going to buy the laundromat cleaner supply distribution chain because they do such a fantastic job, and I know I can scale it up 30%. I love hearing those kind of stories. I did want to touch on, and also the idea that, like, there's a problem, I'm going to fix it. Like, that's the true entrepreneurial spirit. I want to jump back to your daughter's perforated eardrum for a second. The reason being that the thing that kind of stood out to me when I was thinking about this is, how the hell are they able to say that it's not medically justified? Like, how is it that insurance companies are able to do that when it's at the direct advice, I assume, of the physician at the time, and not open themselves up to litigation?
Yeah, because these health insurance plans are protected. I mean, you got to think about, they have such deep pockets. They do more lobbying in DC than anybody.
Really?
And so they're protected. And in fact, what I found after the fact is that about 20% of bills, close to it was 18%, I think, last year, are denied. So you have an almost 1 out of 5 chance of getting these bills denied. And I unfortunately was the one out of the 5. Fortunately, I had done well, and $8,000 is not that big of a deal. But for hundreds of millions of Americans, $8,000 is a big deal. I think there's some stat where it's like 70% of people can't come up with $1,000 in an emergency. And so what I found was about 250,000 families every year go bankrupt due to a medical expense, even though they have health insurance. So that's crazy to me. And so there's nothing for us to do if we get denied. I mean, we can go and reach out to the government and say, these health insurance plans are, taking advantage of me, but the health insurance plans have all these people in their pockets, right? And so it's a really hard thing for do. There's nothing a consumer can go and do to rectify the situation without significant legal expenses and things like that. So they put enough friction in the system where it's more like, I'm not going to do it. I think only like 2% of the bills that were denied last year were appealed. And so they make it so difficult for you to do this that they don't do it, and so they kind of manage their economics around denying bills. there's this crazy thing in the United States, and people, but Bitcoiners understand incentives. Incentives are everything. And so, the incentive for the U.S. government is to continue to print money to give people free things so that they get elected. Like, that's the incentive. The incentive for the health insurance plans is a little bit more complex, but it's still easy, I think, for a Bitcoiner to understand, where we have this thing called a medical loss ratio. And not to get into too much detail, but 15% of your premium can be used for profit with a health insurance plan. So if you have $1,000 of premium, let's just use round numbers,
Yep.
that health insurance plan can make $150. And the politicians in DC think this is a great idea because you don't want to fleece Americans by, over profiting off of their healthcare. The problem with this now is that, how do I grow that 150 by 10% to 165? Well, premiums have to go from $1,000 to $1,100. And so they have every incentive in the world to see these premiums rise because it means they make more money. And so that's just the perverse incentive system within healthcare. So you're screwed twice. Within the year, they're managing to this 15% profit. So if it goes to, let's say, the 85% of medical costs go to 86 or 87, they start denying bills so they can maximize their 15% in year, excuse me.
Yeah.
And then over the long term, they want to see medical bills rise, which that has, right, clearly. And so that we're screwed that way too. So people think this is like very, very complex healthcare. It's not complex. You have the buyer of healthcare, these health insurance plans, they want the price to go up. You have the seller of healthcare, which is these big hospital systems. They clearly want the price to go up. So you have the buyer and the seller of the service both wanting the price to go up. It doesn't take Safedine with a PhD in economics to understand if the buyer and the seller want the price to go up, the price is going up, right? And so that's the problem that we have within healthcare in the United States. And what we're trying to do is saying, no. We want to apply some market forces to healthcare to drive down costs. And in essence, what we've seen over the last 4.5 years and 25,000 plus bills is that we're getting prices for our members that are about 50% less than health insurance plans. And so, just by paying your doctor directly without having an insurance bureaucracy, in the middle for billing and all that kind of stuff. So it's really a decentralization of healthcare that reduces costs, by about 50%.
It's incredible. I'm trying to frame it out in my mind because I'm coming from Canada, so I'm coming from the Socialist Republic of Canada, which I'll get your thoughts on that in a second as well too. But are there government subsidies involved in these insurance programs of the hospitals as well too? Because what I'm trying to think of in my mind is like, okay, if the customer is not the person buying the insurance plan, right? Obviously that can't be the case. So it's almost like the hospital is the customer of the insurance plan, or there's a government, there's somebody else calling the tune if both parties want to push up the prices.
Yeah. I think it's a wink, between the hospitals and the health insurance plans. I think ultimately the hospitals raise prices, every single year, so much so that the health insurance plans are kind of like, okay, fine. And so then we have this 2 to 3 times X, inflation in healthcare because they can get away with it. And the health insurance plans have an incentive for it to see it rise. And so there's this kind of oligopoly, situation that's happening here, that if anybody had significant amount of money, they could for sure, take some legal action on this, because there is no doubt some monopolistic behavior that is happening. And then you have the government on the other side who are now subsidizing, these health plans. And as we know, like everything that's subsidized by the government, the price goes up. Most of us have probably seen that graph, or it's this graph over the last 30 years, and it looks at all the products and services that we buy, and it's like anything that the government touches, healthcare, public education, higher education, all that stuff is going up, much more than inflation, 2 to 3 times inflation, and everything else is going down. Like the cost of your TV has gone down, your cell phone has gone down, everything else has gone down. And so it's just such a pure example of like anytime the government gets involved in this stuff, the price goes up because nobody cares about the price. And that's the problem we have in healthcare is nobody cares. You can go get, like, I'm basically shopping with somebody else's credit card, right? So
Yeah.
give me everything you want, and again, not to go into too much detail, but the rebuttal against what the statement I just made was, oh, well, people have really high deductibles, which basically means the amount you have to pay before the insurance plan pays anything. And so they should care. But my rebuttal to that rebuttal is anytime you have anything really big, which is where the vast majority of the healthcare costs are going, you bust through your deductible anyway. And so you really don't care. 80% of the costs in the United States are for chronic diseases.
Yeah.
If you have a chronic disease, you're busting through your deductible. And therefore, you don't really care what the price is. Like, give me whatever you want to give me. And so that's the problem that we have, is consumption without limitation on price. If you could go and we had this situation recently, if you could go get a knee replacement that is, a mile from you and it's $25,000 versus me having to drive 100 miles and it's $12,000, would you drive that 100,000 miles or that 100 miles to save, $12 or $13,000? In any other situation, we would say, I'm driving 100 miles to save that money. In healthcare, we said, no. I want to go here. I want to go a mile from me because I'm not ultimately paying for it. So that's a perfect example of how these incentives are totally screwed up and why our healthcare prices continue to go up.
No, that makes perfect sense. Well, in that example too, like the only cost really is your time driving, so you don't give a shit about the dollar value of the surgery that's going on.
100%.
Imagine mining Bitcoin cheaper than buying on an exchange with direct payouts hitting your wallet like clockwork. SAS Mining makes it real. You own the rig, no gimmicks. It's your asset pumping out Bitcoin every single day. No markup on hardware or electricity. They get paid when you get paid, fully aligning incentives. Mining Bitcoin below exchange cost is a great way to DCA your stack. It's so simple, anyone can do it. No tech skills required. You get white glove support and education, a rig performance guarantee, plus it's powered by 100% carbon-free energy prioritizing renewables. Ready to take control of your Bitcoin future? Visit sasmining.com by scanning the QR code or clicking the link in the description down below to book a free consult and start mining today.
Stuck on your Bitcoin setup? Unlock expert guidance from top educators. Schedule a free chat at bitcoinmentor.io and get started hassle-free today. All right, let's jump back into the episode.
Correct me if I'm wrong too. So I was talking to my wonderful co-host Gary, who's not here today. He's slacking. He's in New Jersey, and he was telling me that like he's not able to get like just simple catastrophic insurance, and that it's mandated that he has it as well too. So not only are you pushed into this funnel, but am I correct in knowing that like in some areas at least you have to buy this product as well too? You're a forced buyer.
You're a forced buyer in 5 states. New Jersey, Massachusetts, Rhode Island, Vermont, California, and I'm probably missing one, and DC. And so they force you to buy health insurance or they fine you as a result of that, which is,
Right.
Absolutely ludicrous, from my perspective. So, the fines, depending upon where you are not that bad. And so oftentimes we got a lot of members in all of those states, because they just pay the fine. They're like, screw it. I'm saving more money with CrowdHealth than, I would pay the fine. I mean, I had a guy the other day who was paying $50,000 a year for healthcare, 50 grand in just premiums. And so, for CrowdHealth, it's about, for a family of 4, it's about $7,000. And actually last year we only charged, not to get into the details too much, but like max of 7,000, but we only charged 6,000. So he's looking at this and saying, okay, $44,000 I can pay if I want to go with health insurance, or I can pay like a $3,000 fine and go with CrowdHealth. He's like, this math makes sense for me. And I was like, yeah, it makes total sense. Just pay the fine, join CrowdHealth, and you get all the other benefits of not having health insurance.
I just want to add that I used to do the exact same thing in a very small little example. The old job that I used to work at, it was cheaper for me to pay the parking tickets than to pay the cost of parking.
Yeah.
So I just got the parking tickets. They didn't hit me very often. I get 1 or 2 maybe a month, but it was way cheaper than paying for parking. So I had absolutely no issue with it. Again, it's just the automatic incentives lining up. One thing that also jumped out, even just talking about, like, it's so hard to unravel all the little like fiat intricacies when you get into this stuff. But one, you're finding people who might not be paying for health insurance because they can't afford it. So that just seems completely counterintuitive. And then additionally, there's the idea of like you're talking about, like most people don't have $1,000 earlier in the conversation. And I was even thinking like, the state of like people are so on the hamster wheel, like 2 parents working, got no time, your food is shit, you're falling apart. Most people, like not most people, but like a good subsection of people, if you ask them if they could even borrow $1,000 from a friend, like no questions asked in an emergency, I'm not sure that they even have time to maintain those kind of relationships. They even have like a community that they can lean on at this point.
Yeah, totally. I mean, and so what we did when we started was like, look, I think everybody can come up with $500. You can figure out $500. Like, I don't want anybody, 250,000 people went bankrupt with health insurance last year. Over the last 4.5 years, 0 people have with CrowdHealth have gone bankrupt as a result of a medical issue. And we have ours set at like, hey, if you have a big procedure, you need to have a little bit of skin in the game. And so the way that it works is you pay the first $500. Let's just say it's a $10,000 surgery. You pay the first $500, and then the community of 20,000 or 15,000 people now will help you out with the remaining 9,500. And so in essence, what happens is your 500 plus the community's 9,500, you now have $10,000 of cash to go and pay for your procedure directly. So you're paying the doctor direct. There's no intermediaries. There's no anybody else between you and the doctor. Like, they can actually provide the care that you need, as opposed to a health insurance company, dictating what you can and can't do. We just had to go and do it. Whatever you and your doctor think is right, then go and do it. I always say, like, you work for whoever pays you. And, ultimately the doctors are being paid by health insurance companies. In your country, the doctors are being paid by the government. And so they actually work for the government. Our doctors work for the insurance companies. And so, I want the doctor to work for me, not for the insurance company, especially when it comes to my healthcare. And so this is a great, because it's now between you and your doctor, no intermediaries. The doctor works for you. And what we have found is, like, the docs are like, this is awesome. Like, we can do now what we need to do to make you healthy. Under the insurance system, it is, I need to deal with your symptoms, which is typically a pharmaceutical solution, versus our system, which is, hey, now we can actually start talking about your lifestyle, and are you working out, and are you getting great sleep, and are you, all these types of things. And you can actually spend more time with somebody, because you don't have this health insurance company that says you have to keep your, time with your patient to X amount of minutes and all this kind of crap that they have to do. So it's just a totally different model. And I get, again, once you decentralize some of these systems, it works so much better. We see that in Bitcoin. We see that in healthcare. I think there's probably dozens of other industries that we can decentralize as well. But I think, way more efficient if you get this decentralized. Have the decision making between the doctor and the patient. That's the way it should be. No other kind of perverse incentive related parties involved. And so it just works much, much better.
I completely agree. It's funny. It's just like, we're taking that Bitcoin kind of ethos and we're applying it to the base layer, like Maslow's hierarchy of needs. Like, let's just fix our money and our food and our health first and foremost. Then we can kind of build up from there. I'm curious if you have explored the clusterfuck that is the Canadian healthcare system at any point in time during just your travels here. Because for anyone who's not aware, it sucks. Like, there's a lot of places in the country you can't possibly get a doctor. If you need anything kind of major, you're looking at wait times that are like over a year. And I just double checked the stats last night. 1 in 20 deaths, it's a little bit less, but 1 in 20 deaths in Canada are medical assisted suicide. So that's our healthcare system. Is they're just like, hey, you're sad, you're down, you're hurting. Let's just take you out back.
Just kill yourself.
Just kill yourself.
Which is it's a tragedy. I mean, there's been a kind of a viral story where this woman, this was back in the spring, so about 6 months ago, she needed an MRI for potential brain cancer. Like, her doctor was like, yeah, you need brain cancer. You might have brain cancer. You need an MRI. She had to wait. It was a 2026 date. I forget exactly when it was. So March, she's told in 2026, you can have this MRI for your potential brain cancer. And you're like, what the hell? Like, that's absolutely crazy. I know in some parts of your, in your country, like, you can get it more accessible, but there are many, many parts, as you said, where you got to wait. You got to wait. I mean, I've also saw situations in which people had broken bones that they couldn't get surgery on, that they had to wait so long that the bone went in at the wrong, healed at the wrong way. So they had to re-break the bone to fix it because they had to wait so long. You're like, guys, like, this is so, well, it's less expensive. Well, maybe, I don't think it actually is, because you're paying ridiculous taxes to pay for it, and your outcomes aren't as good. And so, it's a total cluster, and everybody wants to say, let's just not deal with the system. Let's just let the government deal with it. We see how that goes with the fiat, monetary system. It's a tragedy when that ends up happening. So, we're in a battle against that. So as you can imagine, everybody who wants Medicare for all
Bad idea.
hates the CrowdHealth model. Everybody who's like, no, I want self-sovereignty over my own healthcare loves our model. And that's why something like 20 or 25% of our community currently are known Bitcoiners.
Nice.
They've actually signed up using a Bitcoin code. So we know that they came from, Marty or Natalie or Safe or somebody like that, because I've been on their podcast as well. And so it's a great community to be a part of, because we have a lot of people who are like, no, I'm going to be responsible for my own healthcare. That's the community I want to share healthcare expenses with, not the people who are, entitled and thinking, oh, healthcare is a right and I can be able to consume as much of it as I want, even though I sit, on the couch all day eating brownies, right? Like, that's not who we're looking for in the community.
Completely agree. It's funny too. Even just quick side note: the last time that I was in a Canadian emergency room, I took an angle grinder to my thumb accidentally, and I sat there. I don't know how long I was there. It got to the point where I just said "fuck this," and I left and got super glue and put it back together because I got so tired of waiting. And like like, for people in the U.S. that don't know, it really sucks. You do not want universal healthcare. It's atrocious, and it's only getting worse by the day. I want to unpack that a little bit. So, what is currently like the relationship between CrowdHealth and Bitcoin? And was this something, were you a Bitcoiner before you started CrowdHealth, or was this something that you found along the way?
Yeah, it's interesting because I'm friends with Jimmy Song. I'm sure most people
Nice.
listening to this is knows Jimmy. I live in Austin. We, have friends in common. So I met him over steak, of course, for
Of
lunch.
course.
That's just how he rolls, right? And I was telling him about this. He's like, man, the problem with health insurance is that, these health insurance companies have this big pool of fiat that's declining, every single day. And back when I was talking to him, CPI was 7-8%, something like that. So it was, I will still argue with you, CPI is significantly higher than what they're telling us it is today. If you just go in the grocery store, you'll notice. But he's like, that's the problem with insurance, is they got this big pool of fiat. And he's like, man, what can you do with Bitcoin here? Like, how can you figure out Bitcoin? I was like, Bitcoin? Tell me more. And so he orange pilled me. I went into Bitcoin. So I'm class of 21. Fortunately after the kind of, it went down in 21. So I'm in the teens, thankfully. And so, I started thinking about Bitcoin and researching it, and read all Safe's books and all this kinds of stuff. And I was like, man, we've got to figure out a way to incorporate Bitcoin into what we do. We've got to take stages in this. It's taken, 15, 16 years for us to get to where we are in Bitcoin. I think it's going to take, a decade for us to figure this out on the healthcare side. But ultimately what I want to do is I want to be able to transact all of these expenses in Bitcoin. We've got a good group of Bitcoiners. I want them to transact in Bitcoin. I want them to be able to pay hospitals and doctors in Bitcoin, because I think Bitcoin circularity within healthcare, which I just saw the last number, is like $5.6 trillion in the United States last year, or maybe it's forecast for this year, but
Yep.
it's a huge market. I mean, maybe the biggest market on the planet, right? 5.6 trillion. If we can get Bitcoin circularity within healthcare, I think that sets the stage for Bitcoin circularity in other places. And so I'm a big medium of exchange guy. I know there's this debate within Bitcoin, medium exchange, store of value, all this kind of stuff. I think it's both. It's great store of value, and it could be a great medium of exchange. And so, we're actually talking to one of the largest health systems in the United States. It's a top 10 health system, who is contemplating accepting Bitcoin. And so we're working hard to get doctors, hospital systems set up so that they can accept Bitcoin. So we have Bitcoiners on one side who want to pay. We have these hospital systems on the other side who are okay with receiving. And if we can build that network, then I think we have something really, really, special. And I think it not only does good things for the healthcare system, it does great things for Bitcoin. So if I can take down the financial system and the healthcare system as we currently know it, and what is it, two birds, one stone, like that, man, let's go. It's the two most regulated industries probably on the planet too. So I spend a lot of money on regulatory attorneys, but that's ultimately what we're trying to do. So I can get some more Bitcoiners to sign up. The back end it's ready. We've built it on Lightning. And so it's super easy. We just needed enough Bitcoiners to join us to make it viable.
Are you sick of the fiat-funded fast fashion that falls apart quicker than the dollar? You know, the cheap stuff made to drain your wallet one inferior product at a time? Stop it. There's a better way. Panties for Bitcoin is a family-oriented company built by Bitcoiners for Bitcoiners and held to that unbreakable Bitcoin standard. Certified made in Italy underwear that lasts as long as your metal backups. Guys, grab a couple pairs of those lightning boxers for yourself, the softest, most comfortable, durable pair you'll ever own. And surprise your lady with luxurious panties, bras, and thongs. No better way to spark those all-too-important Bitcoin conversations and spread adoption than attractive people in their underwear. Naturally, you can pay with Bitcoin, supporting the circular economy and building that parallel system. Simply scan the QR code or click the link in the description down below and head to pantiesforbitcoin.com and use promo code BTC Sessions to save 10%. Snag yours and share your love for Bitcoin in a new peer-to-peer way. Attention all freedom-loving Alberta Bitcoiners. Tired of the big six banks freezing funds, blocking transactions, or slamming your account shut without warning or explanation just for dipping into Bitcoin? Remember the Freedom Convoy debanking nightmare?
The federal government has invoked the Emergencies Act.
But don't let them control your money or erase your financial life. Join the pioneers over at Bow Valley Credit Union, a place run by freedom and sound money advocates. I bank there myself. They are the first and only traditional bank or credit union in Canada to directly integrate Bitcoin via their Bitcoin gateway. If you have to use dollars, why settle for a fiat-only account when you could seamlessly move in and out of Bitcoin? No hassle, no questions, no rehypothecation, no leverage. This isn't paper Bitcoin. Withdraw to self-custody at any time. Insured and auditable, it's perfect for adding Bitcoin to your corporate balance sheet. If you or your business is in Alberta,
Switch to your Bitcoin refuge at bowvalleycu.com.
scan the QR code or click the link below.
That's incredible. That would be fantastic. Because the other thing too that immediately struck me is that's healthcare touches everybody, right? We're all gonna get old. We're all gonna die. You're gonna see a hospital. It's gonna happen no matter what. Which means that the entire U.S. population would eventually have at least one touch point with Bitcoin, or at least see it, right? That it's used, that it's paid, a little familiarity with it. Wow. So that would be essentially a $5 trillion market that is then accepting Bitcoin. And for the record too, I'm with you on the medium of exchange side in the sense that I think it was Parker Lewis that I think first pointed this out to me in the sense that you can't separate the two. For it to be a store of value means that you must have the anticipation of being able to exchange it in the future. They're one and the same, just on a different time scale.
100%. I was office for a while at Bitcoin Commons right next to Parker, and so I think
Nice.
Parker was one of my big influencers of understanding that. So he's a member of CrowdHealth. So is Safety, so is Natalie, Robert Breedlove, like Jimmy. All these
Nice.
people that in kind of Bitcoin circles are members of CrowdHealth, because I think they see that, right? They see this, that they've got to be a part of something, even though it's small right now, and we're not doing a ton of on the Bitcoin side, but the vision is to have this all being transacted over the Lightning Network. The other thing too is we got a pretty significant back end fintech system that's unfortunately built upon the fiat system, and for me to go out to the community and say I need $10,000, it takes like 4 or 5 days for that money to get from, say you were a member and I was giving you money, from me to you. It takes like 4 or 5 days between, everything settling and the banks transferring and all this kind of crap. And ultimately, all they're doing is they're being rent seekers, right? They're just holding on to this money. They're getting the interest off of it, right? And not allowing us to have it. Whereas Lightning, and we've already, tested it out, and it's like that, boom, I can get you money in seconds. And so it's just a much better system to be built upon. And so we just need some other things to fall in place here to make it work. So, I would just say, is any Bitcoiners out there who are thinking about healthcare for next year, like, join us in a mission on not just healthcare, but know that my heart is to also change the financial system. And we need more Bitcoiners to join so that we can get the scale necessary to do this.
I do want to ask kind of like your outlook for next year as well too. But before I jump off that point, because what struck me is like I was trying to think of like what would the hospital's incentives be in order to accept Bitcoin? How am I going to convince or sell? What would be the benefit to them too? But I think you just pointed out, because in those sort of situations, you got a member who's got, let's say we've got an emergency situation, a member that's going in. Is the hospital basically just holding are they just holding an IOU for how much they have and waiting for settlement? Or are you having to like take cash from somewhere else and pay it in the meantime and then regroup? Because there's that delay in between. Because to be able to turn to the hospital and look, I can pay for the surgery right now, final settlement, I think they would like to have that, because I imagine they have to deal with a lot of loss or basically chasing after people for bills after the fact.
Yeah, you hit it on the nail on the head. The great thing with that is you're actually keeping the float, and for every day that you wait, the hospital doesn't have their money, and so they're willing to negotiate. And so if you were to go to the ER, typically what happens in the United States is Not typically, this does happen in the United States. You go to the ER, they have to take care of you regardless of whether you have insurance. So there's a law that says, you know, if you haven't, regardless of your insurance status, you have to be taken care of. So you go in the hospital, you get out, and then 30 to 60 days later, they send you these bills, you know, and they're usually like 30 pages long and you can't understand them. And that's on purpose. And so then what we do is we then take those bills, and we've got a team of negotiators and including attorneys on our side who will call the hospital and say, listen, if we can pay you in the next 24 hours, would you take X price? And most of the time, you know, that price is about 50% less than what health insurance plans pay, but they get it immediately. And so, and we've kind of already pre-funded that money to make that deal. So we can get it to them, you know, immediately. And they're like, yeah, you know, we'll take it. If I don't have to fight with health insurance plans, then, you know, money now is a lot more valuable to me than money in three to 6 months when a health insurance plan will pay me. So that's why we do the negotiation for you and those emergency visits. And then for non-emergency visits, let's just say you're going to get a knee replacement or something, and it's, you know, knee replacement will probably be $15,000 to $17,000, something like that. You know, we fund it first so that you have the money and you can pay the doctor as you walk into your surgery. So that doctor gets the money immediately. You know, as a result of that, you know, the prices, like I said, are about 50%. We had this woman here in Austin, actually, who tore her ACL playing pickleball. Went to the ER. They tried to get her to like a hospital affiliated doctor, and they said it was going to be like $22,000 or $23,000, something like that. Well, we had another doctor in town who's really good. We're in Austin, which is the University of Texas is here. He does a bunch of the joints for the University of Texas athletic program. So he's really, really good. He's like, look, if you can pay me at the point of care the day of, I'll take 11,000. So it went from 20, whatever it was, 23, 24, something like that, to 11,000 just by paying them at the point of care and getting out of that hospital system. So that's the way that we work. We're not asking people to front a bunch of money. We can, you know, get that funded for you prior to you having to pay that. So it's a really efficient way of doing things.
That makes sense, right? There's a cost to everything. I think probably even within the existing corrupt system, people would have forgotten that there's a cost to having to deal with the insurance, that there could be a benefit to going direct to the customer and being paid up front. I also just did want to
30
point
to 40% of the costs are administrative.
Yeah.
So, you know, the doctors, there was a study that came out, I don't know, maybe 6 or 9 months ago, something like that, where doctors are spending between 16 and 18 hours a week fighting with health insurance plans to get paid, the administrative component. So imagine like you spending 2 days of your week basically fighting to get paid, which means you're not taking care of patients, you're not generating revenue. You know, it's a total cluster. And that's why these doctors are willing to take much less if you pay them at the point of care. You get rid of that bureaucracy.
No, 100%. Lastly, on the kind of the Bitcoin note, that well, not lastly, but another thing on the Bitcoin note I want to hit is what share of members are actually saving in Bitcoin? And I was curious. So last night before we jumped on, I ran the math too quickly. I looked up what the Affordable Care Act cost. I found was $590 per month. If you DCA'd that over the last 4 years, you would have spent $28,910. You have over 73 million sats, and you'd be up to 79K right now. And for comparison, I found that the average birth in the US was 18,865, which means if you started saving in Bitcoin 4 years ago instead of that stupid Affordable Care Act, you could afford 4 babies right now.
I mean, it's crazy. You know, so an individual, what'd you say, is 580 or something like that, or 5 whatever?
Yeah, 590 was what I was able to pull up.
590. So with CrowdHealth, it's 200. So you're saving, you know, 390 a month, and that's max. So when I say max is, here's the other cool thing that we're doing, and again, it's to align incentives with the community. So we have 2 components. You pay us $60 a month. That's for my administrative, and then I ask you for up to $140 to help somebody else out in the community. So it's maxed out at $200 a month. But we've only asked for that $140 4 times in 4 years. So this month we're only asking for 90 of that 140. And we have a system in place where that 50, if you're a Bitcoiner, automatically gets stacked in Bitcoin. And so if you're a family, it's more like $200 gets stacked in Bitcoin every month. So if the community does well and we're not asking for all 140, the excess, the difference between what we ask and the max, is stacked in Bitcoin. And so you have this kind of little Bitcoin healthcare savings account being created as a result of joining CrowdHealth. So We enable you to do that. It's super, super easy. And so we're trying to, help Bitcoiners stack while paying for healthcare.
Beautiful. Now, Andy, imagine for a moment I'm a critic. I come in and say this sounds not possible. People aren't going to pay for my shit. What if I have some sort of like catastrophic triple bypass surgery? What are the kind of pushbacks that you get on this sort of business structure around healthcare, and can you address them?
Yeah, I think you hit on the two big ones. Like, okay, so why would the community, let's just say you broke your arm and it was, $8,000 or something. Why would a community help me with $8,000? Or, with a broken arm? It's not like a heart tugger, right? It's not like my kid with cancer, but we have a really cool system of kind of game theory here that happens where we go to the community with that, let's just say it was an $8,000 broken arm. You're paying 500, so we go to 75. Go get 7,500. We'll just say 75 people for $100, and they can, if they say yes, then $100 goes from their account to your account. And if they say no, then we'll just ask the next person. So why would a person say yes? Well, when I ask for that broken arm, it shows the last 10 times I've been asked, what have I said? Have I said yes, 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 yes? Or have I said no, 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 right? And so imagine getting a request from me and it said, the last 10 times Andy's been asked, he said no. Are you going to help me? Probably not, right? And that's what we've seen in the data is people who are takers and not givers don't typically get their bills funded. But people who are givers to the community, 100% of the time, they've gotten their bills paid. And so we use some game theory here to say, okay, this is a voluntary giving. We have to do that for, regulatory reasons. But there is this kind of reciprocity that is created within the community that 98% of the time I ask somebody, they'll say yes. And so the 2% that say no, we just ask the next, 2% of people on the list. And that's how those bills get funded. So, we've funded, I think it's 99.9% of the bills. That 0.1%, the bills that were submitted to the community, that 0.1% are from people who are takers and not givers, where the community was like, you're not a good member of this community. No way. Right. And so that it works really, really well. And then the second point you made, which I think is a big one, and one of the biggest concerns is like, okay, what about the big one? We had this guy last summer, and we're actually doing a little documentary on him, where he was in Montana fishing, and so he was in bear country, wolf country. Ooh. So he had a 44 in his strapped to his chest in his holster. He caught a fish. He was reeling it in. He leaned down. The 44 fell out of his holster, hit a rock perfectly, went off. Bullet went into his calf, out the back of his calf, into his thigh, out the top of his thigh, into his chest, and out the back. Right. So one bullet, 6 holes. He was in the middle of nowhere, so they had to medevac. His wife was with him. His wife took off her shirt and put a tourniquet around his thigh because they thought they hit the femoral artery. And she ran up to the top of the closest hill, called 911. A helicopter landed in the middle of the stream to pull this guy out. He gets to the hospital. He goes into a coma. He finally comes out of the coma after, I think it was a couple weeks. And then he had to drive home to California because they couldn't get on an airplane. He went into sepsis on the way to California. And so this was almost $1 million bill. Monster bill. And so we went in and we negotiated it. We got that bill down to somewhere like 200 or 250,000 or something like that. And the crowd was able to fund that, without a problem. And so we've had, I think, 36 cancer cases now, something like that. And they're like colon. I saw one go through this morning that was for breast cancer. And so we've had these really big bills, these really big situations in which, I kind of say healthcare is expensive if you do it through health insurance. It's not nearly as expensive if you pay direct. So we've had lots of these big bills, heart attacks. We had a Bitcoiner, unfortunately, 2 weeks ago, had a heart attack over the weekend. He's fine now, thank God. But that's gonna be no problem for the community to fund. So we've had a lot of these big bills, and you have 15,000 people who've got your back in case one of these big things happen. One lady had, I think it was non-Hodgkin's lymphoma. It might have been melanoma. I can't remember which one it was, but she had a pharma bill that was $40,000 a month.
A month?
A month. And so we went in and negotiated directly with the pharmaceutical company again, ripping out all the middlemen, and got it for $2,500 a month. So, these things are really expensive. And everybody's like, well, what about these multi-million-dollar bills? I'm like, do you really think a brain surgery, even if it's at, Stanford or something, and it's a 5-hour brain surgery, really costs $1 million? Like, no, like it doesn't. They are ripping you off because they got the brand name and they can charge that because the insurance companies will pay it. But when you're a cash pay, direct pay, you can get that down 75, 80, 90% oftentimes. So we can really help with the big ones. And in fact, I say we're better with the big ones than we are with the small ones. And so that's one of the benefits of paying direct.
Amazing. I'm curious, maybe you can't disclose, but I'm curious, what the hell with the guy that got shot 6 times by his own 45? Like, what unbelievably terrible luck, and it landed in the worst possible way. It must have been like directly under him. How much was the helicopter?
I think they billed like $70,000 or something like that.
Okay, yeah, I would have guessed around there.
Yeah, they billed 70. I can't remember exactly what he got it for, but I think it was, it was still like 20 or something like that. We negotiated it down to. But a helicopter flight emergency going, a couple hours to the nearest hospital. I'm kind of like, sounds kind of like a $20,000 bill. I mean, it seems kind of reasonable to me. So, it's still not inexpensive, but when you got a community back of you to pay for it and the negotiation capabilities that we do, then it's much more manageable.
Agreed. It's funny. The reputation thing I think is fascinating. I'm curious how you came up with this model and if you were terrified when you first started implementing it as well too. Because I mean, you had that depends on your faith in the community of which way this might go very, very quickly. But I've noticed this constant thread in Bitcoin that in a weird sort of sense, I'll see if I can articulate it. When we no longer have to have any trust in the money, like there's no trust in the money anymore. Your reputation becomes so much more valuable. We see trust within each other. Like as soon as I go to a Bitcoin meetup or a conference, like immediately we're like fast friends, same footing, and we're good to go. And I think that your
The
reputation,
worldviews are the same. Yeah.
yes, and I think your reputation on a hard money standard is so much more important than it is on a fiat standard, or maybe it's just more elevated on a fiat standard. So I'm curious, one, how you kind of came up with that, and yeah, if you're a little bit nervous implementing such a system.
Yeah, I would say like, with entrepreneurs, you kind of always ask them like, what keeps you up at night? And I will tell you through the first year, getting a big event like this one was what kept me up at night. A NICU baby, like those NICU babies are, man, they're wickedly expensive. And so like, please, like, God, like allow our people to be healthy. And, thank God that they were healthy for the first year. Now I'm like, when I hear these things come through the system, I'm like, man, I love the fact that we can help these people in really hard situations because I know I have an incentive to get these bills paid, right? Like unlike the health insurance companies, based upon, what you were just saying, the trust is if I don't help somebody get their bill paid, I'm screwed, right? Because my trust is, obliterated. If Jimmy Song went on, X and said, Andy, didn't get my bill paid, I would be toast. And so like, I've got every incentive in the world to fight for you as opposed to fight against you, which is what the health insurance companies are doing, fighting against you. And so, yeah, I mean, I think that the trust has been built up over the last, 4.5 years. And I think people, are finally, trusting us. I mean, inevitably you get people who are really, really pissed off, because we had this guy who's, hammering us right now online because he wanted to go and get a surgery for something that was before he got into the community. And so he wanted the community to pay for it. And we have a very strict kind of pre-existing condition thing where it's like, look, you can't just jump into the community and drop things on the community and then leave. Like, that's just not right. It's just not morally right from my perspective. But this was $100,000 surgery that only one doctor in the entire planet did. And we knew he was getting bamboozled by this doctor, right? And so he's really pissed off at us because we're like, look, it's a pre-existing condition and you're getting bamboozled by this doctor. And so, we're not going to submit that to the crowd. We're going to protect the crowd, in that situation, which I think is the right thing to do. And he went and got the surgery anyway. He paid $100,000 out of his own pocket. And guess what? It didn't work. Shocking, And so there's situations like that we have to make a call, but it's for these wacky, like, miracle procedure types of things where these doctors are like, really trying to scam people from my perspective. And so we try to protect the community from these scammy doctors, and people are pissed off about it. And it's like, look, I'm happy to go on trial on this one, because this is one where I think the community will be like, hell yeah, we're not paying for, a bamboozled doctor to line his pocket. So it's not a perfect situation, but I would say that if you went and looked at any of our reviews, like, people love the fact that we are super, customer centric, because we have to be. We have to have that trust with our customers that we're gonna, get these bills, help them get these bills paid when they come.
No, 100%. Like, the term quack exists for a reason. And then also, like, looking to have the community pay for your house if it burns down while the garage is currently on fire is kind of like, no, that's not how the system works. We're all taking on risk, but it comes from the uncertainty. If you already have the certainty of needing the surgery, supposedly, then it's not, you wouldn't be entered into the community. That makes absolutely perfect sense.
Well,
I
in
know
that
that
situation, by the way, just
Yes.
we want to have, like, make sure that we're not the ultimate arbitrator of that. So if we say no to a bill because it's from a quack, then you can appeal it to a group of CrowdHealth members. So we have a group
Oh,
of
nice.
members that say, like, look, we'll make our case, the member can make their case, and then we'll let the community decide. If the community wants to pay for it, then great. If they don't, then that's fine too. So, we're not the ultimate arbiters. We do a filter, but if you have any issue with, our decision, you can appeal it, and it's beyond our control. It's a 5-person panel. Whoever gets 3 votes, that's the way it's going to go. And so we don't want to be, that bureaucratic middleman to say what can and can't happen. It goes to the community in that situation. So, and funny enough, this guy doesn't want to send it to that appeals panel because he knows he's going to lose. Because it's very, very clear this doc's a quack. So it's a hard thing to navigate sometimes, but we do our best, and I think we've built trust within the community that it's like, since we have no incentive to get these bills not paid, I think people trust us in that we do a pretty good job of filtering out some of the quack stuff.
Beautiful. I did want to ask for anyone listening as well too.
We're filtering out, like, the ETHs of the world and the Dogecoins of the world, if you will.
The shitcoin doctors.
We're the shitcoin filter.
I love it. For anyone that's looking to healthcare kind of in 2026, we're looking to the future a little bit too. What is the current state? Are things going to be worse next year? Are things going to be better? Those laws where you can't have, like, the catastrophic and you must have a plan. Any chance of those going away? Are we declining and still, or are we seeing any rays of sunshine on the horizon?
Yeah, no, there's no rays of sunshine, unfortunately. I mean, we're reliant upon the government to get this stuff figured out. As you know, we're in the government shutdown right now. It's over these big subsidies that the government is paying these health insurance plans to take care of people. I think it's a bad idea to have these subsidies. We're giving people that ray of hope so that they don't have to pay for these ridiculous prices. I think prices are supposed to go up 18% next year, from what I understand, for health insurance.
Whoa.
And so people are starting to get these. I would say we had more customers sign up in the last 4 days of October than we did in any month since January. And so people are, like, pissed off. They're ready for something different. And I think we finally now have given them, an alternative. And so we're seeing, huge growth, and it's so cool to finally see this happening.
That's great. I imagine you've probably run the numbers. I would think at some point in time that this government subsidized healthcare in both Canada and in the US, to some, like Medicare, as well as like the Affordable Care Act, it's gonna implode, isn't it?
Yeah. I mean, what we're seeing now is these prices are so high that the healthy people are saying, hey, I'm tired of subsidizing the unhealthy people. And so they're dropping out of the system. And so once you lose all that subsidization from the healthy people, you go into a death spiral, ultimately. And I think we're seeing that in the United States healthcare system. And so, I think that there's a risk there, which, finally people are like, okay, fine, let's just let the government, do it. And so ultimately what we're trying to fight against is that narrative, right? Like, no, don't let the government do it. Like, there is an alternative way of doing it here. And so ultimately we want to get our name out there to say there is an alternative. We don't have to do Medicare for all. We don't have to end up like Canada, no offense.
No, don't take it. It's awful.
Yeah. And so, there is, we want to create some scale here so that we can actually go to some of these legislators and say, look, there's a viable option without having to do Medicare for all. And at a minimum, give people a choice. Like, give people a choice if they want to go with the government system or with a private system. And we think we've built a private system, a community-based system that's way more effective than anything else out there. So give people a choice in what they want to do. I think ultimately that's the ultimate freedom, right? Giving people a choice as to how they're going to spend their money.
That's great. Just out of curiosity, because I just realized a small parallel. It's not a big one, but a small parallel. Were you aware of the Silk Road in Ross Ulbricht before finding Bitcoin?
Yeah.
Okay, yeah. I just realized, like, this is a
Yeah, no,
completely
I knew about
voluntary.
Ross.
Yeah, this is a. Had you already gone down the kind of libertarian Austrian economic ANCAP rabbit hole? Because I just realized that that's exactly what you're building, is like a completely voluntary community organization, market led healthcare solution.
I've always been libertarian leading. I always kind of like keep government out of my business. And so that's always been my kind of political leanings. And so I'm, other than the last one, the two before that, I voted for libertarian candidates. This one, I felt like the alternative was just like too socialistic. And so I couldn't go that direction. But yeah, I've always been libertarian. And in fact, I first wanted to get into Bitcoin in like 2000 and let's see, I sold my company. Yeah. So it's 2012, 2013. And I was like, man, I told one of my buddies, I was like, I'm just going to put 10 grand into this. Like, if I lose it, it's not the end of the world. And I'm like, and he's like, dude, you're an idiot. Like, that's the worst decision ever. Like, we've all had these conversations, right? Like, you're an idiot. And I was like, and then I forget exactly what it was, but it was like that time where it was like $200 and it went up to like $800 or something like that. And I was like, oh, I missed it. I can't do it now. And then I'm seeing here and it's 100 and whatever it is today. I don't even pay attention to the price anymore because I don't really care. And so I'm like, well, that's stupid me. And so when people ask me, I was like, look, this is my story. I thought I missed it at $800. You're going to miss it at 110,000 or whatever we're at today. Because I think it's going to 1 million plus. And so I tell people that story is like, don't be anchored in the current price. Look at the opportunity and the fact that, gold is 10 times or something like that. The cap of Bitcoin, and Bitcoin is so much more usable. I mean, there's so much, we have so long to go, I think, before we see this thing top out.
Oh my God, I completely agree. We're the thing that I try to illustrate to people is that we are still unbelievably early. Like, the name has recognition globally, but if you ask anybody little details about it, if I walk into a room and ask 100 people if they've heard of Bitcoin, most will probably say yes. If I ask them to explain the difficulty adjustment, they've got no clue, and they'll look at me like I'm an idiot, right? Like, there's still that massive asymmetry that we may have had maybe past even the early adoption in terms of like the ANCAPs, the libertarians, the cypherpunks, that really niche that would have gravitated towards it. But just Gen Pop, no, we're still in innovator stage for sure here.
Amen.
Particularly on the individual level. Beautiful. Andy, this has been fantastic. One, I'm going to now lovingly refer to CrowdHealth as the Silk Road of healthcare, because I think
I
that's
love
fun.
it. I'll take it. I'll do it.
Do it.
Yeah.
Phrase it up. Where can people go to follow you, find your stuff, check all the things out with CrowdHealth? Where should people go?
Yeah, join crowdhealth.com. Go and follow us on X, and we get pretty spicy over there, so it's entertaining to hear about what's going on with healthcare, and it's at Join Crowd Health. So we'd love for you to join us.
Hey, you. Yes, you watching the Bitcoin price movements and the latest exciting news. It's awesome to stay informed, but the real power of Bitcoin comes from taking control. Don't just watch, take action. Head over to btcsessions.ca/learn for free step-by-step tutorials that guide you through every major skill you need to know, plus full video playlists for deeper dives on any topic you like. And if you're ready for the ultimate fast track, scroll to the bottom and check out bitcoinmentor.io for premium one-on-one experience with my team of Bitcoin experts to ensure you get it right the first time. Don't wait. Secure your Bitcoin future today. Hit the link in the show notes or scan the QR code on the screen.
If you enjoyed this episode with Andy, please do like and subscribe, and check out the previous episode with Mike Morelli on fitness and Bitcoin.